Okay, welcome to this webinar, everyone. And this is one of the regular webinars we do where we talk to people who are doing some very interesting things locally, nationally, and sometimes globally. And we're going to interview Barbara Ball today. Now, Barbara's already done a webinar with us. And in that interview, she talked about exclusion and the work that she does in helping pupils and students who are excluded, and the family as well. But we're going to take this further today to look at the particular problems of exclusion that's happening today because of the many, many schools that are excluding more and more pupils, the impact this has on mental health, and how when you try to do something in partnership with the local authority, Ofsted and others, you often come up against bureaucratic problems, which are not easy to deal with. And Barbara's had to face all of this and she's had to deal with it. So we're going to talk to her about it. So thank you, Barbara, for joining us today. Just to remind everyone first, can you tell us a little about your work with children and special needs?
Okay. I manage a small company called ASEND, which only works with children who have special educational needs. And our mission is to support schools and local authorities to put in the right provision for every child who has special educational needs at any level. So we work with children who have got quite moderate needs right through to those with more severe needs. We support schools of all ages and all types and local authorities directly.
So you support all of these, and you're facing in a way what's a growing problem, and that people are worried about this. And there are many children now who have special needs and are excluded from school. Why do you think that's happened?
Well, my feeling, I think it's shared by many other people in our field, is that with austerity and the lack of funding in schools, there is less and less support for children with special educational need within schools. What happens then is that children who have needs, particularly in the areas of speech language communication, social interaction, or social, emotional and mental health, those children are not getting the right support, so things escalate, the children become more and more anxious and then can behave in a way that's unacceptable. And it's usually their behaviour over a period of time, in most cases, their behaviour, which can be extremely difficult at times, leads to the school saying it's affecting other children and they ask them to leave.
So is it because of the Ofsted reports that the schools fear and that they exclude children to get a better rating? Is that the root of the problem, or is there more?
I don't think that's the main problem. I think there are some schools who do that, and we certainly know schools who, when Ofsted come, they ask parents to keep their children at home if they're children who may behave quite poorly, or they organise a sudden outing for those children. I think the pressure on schools to remain at the top of the league tables means that the focus is largely on academic success and less on well-being than it might be. And of course, that pressure for academic success can itself put a lot of pressure on children and make them in turn feel very anxious and affect their mental health. I would say the main reason children are excluded, in my experience, and the children that we work with, the main reason is because of the behaviour they exhibit at school. Not directly because they have autism or because they have ADHD or because they have mental health issues, but because those conditions have led to very challenging behaviour.
So without the right support that schools can get, or maybe not get, their response has really been zero tolerance, and that's caused a part of the problem?
Yes, I think zero tolerance policies have had a massive detrimental impact. They came in the States 20 years ago or so, and I think over the last few years there's been a real pulling back from zero tolerance policies. They came in here a little bit later, perhaps 10, 12 years ago, in an attempt to get behaviour always good in school and saying Children must be very clear about rules and the sanctions for breaking those rules. But of course, what zero tolerance doesn't do is allow for reasonable adjustments under the law for children who have disabilities and special educational needs and whose behaviour cannot always be in line.
So it's a sort of umbrella policy which has no flexibility to adapt to individual need.
Exactly. One school I know, for instance, not in Enfield, imposes detentions for quite small deviations from their behaviour policy, such as perhaps not bringing pencils into class, arriving a couple of minutes late, not having the right shoes, all those kind of things. Speaking out in class, speaking out of turn. And the detentions they start with an hour after school, then they have Saturday detentions. Then if a child doesn't attend a detention, they get a head teacher detention. And before you know it, they're on internal exclusion, external exclusion, and out of school.
I mean, do you think this is a problem that's only developed recently, or has it been a problem that's always existed, but to some extent it's been hidden from the public view?
I think a bit of both. I think it's always existed, and schools have always been very varied in their policies on inclusion and their policies on behaviour, and where the two meet. There's a lot of confusion in schools. They think somebody has special needs, which is dealt with by the special educational needs coordinator. But if they behave wrongly, that's dealt by the behaviour team. And that can lead to an exclusion, even though their special needs are at the root of why they're behaving the way they do. So it's lack of joined up thinking, which has always been there. I think what's made it a lot worse is simply the lack of funding. That what some of these children need is a lot of one-to-one support, mentoring, perhaps from one trusted person who they know, not just a bit of help from somebody who happens to be in the classroom supporting a child with more severe needs, perhaps. But schools are so pressed for funding now that they're trying to stretch their resources. Special educational needs funding to schools, except for those with an education health and care plan, is not ring-fenced. And if they do have a plan and the money is ring-fenced for that child, the school is expected to provide the first £6,000 of that money, and they very often don't and feel they can't.
So they don't have the finance, but is there a problem of not having the know-how? I mean, it's a very specialist thing. Have schools really got a problem of finding out what they can do? And is that why you're there and other people to help them do that?
That's exactly what we've always done, and I think schools do need a lot of support. You know, the typical class teacher and the typical school will be dealing with a huge range of special needs. You know, in one class you might have children with 6 or 7 different kinds of special needs. So again, you're likely to have 1 or 2 children with autism, with ADHD, certainly with anxiety and mental health issues. But that's in addition to perhaps having a hearing impaired child, a visually impaired child, somebody who has physical needs. So you're dealing with a wide range of needs, and it's very difficult for people to do that without external support. Sadly, the pressure on councils for funding means that the teams of people who have supported schools in the past have been made much, much smaller. So there's much less support going to schools from councils. When that first happened, schools would buy in that support from us or people like us. But now they're also a little unwilling to do that because they haven't got the money either anymore.
And is there a problem with schools and local authorities finding appropriate schools or bodies like your own? I mean, is there sort of enough of those? Are they well known? Or do local authorities really not, are not too concerned about it?
I think local authorities would rather not bring in independent schools or services like ours because we have to charge. So I think the first answer of local authorities when parents go to ask for support or perhaps to have their child assessed for a plan or to bring in some expertise or training, the first answer tends to be no.
Okay.
rather avoided and put up. Sorry.
Okay. Okay, so we broke up a bit then, but so I mean, you have this problem. You have the problem of excluded children. You have the problem of schools having to deal with it. You have lack of finance. Now, for some of these kids who are excluded, they suffer mental health problems, don't they? And one of the real problems you have to face is not tackling exclusion, but also tackling mental health.
Exactly, exactly. And of course, their mental health issues, which have probably been at the root cause, I would say almost for most of the children, social, emotional, or mental health issues are at the root cause of why their behaviour is so challenging at school. So it's no good just teaching them when they're out of school. What we really need to do is being able to give them some therapeutic support around their issues, around their anxiety, sometimes around their attachment needs and so on, so that they're ready to go back to school. If you just pop them back in school after a period, it's very likely that those behaviours will surface again.
Okay, so I mean, children have mental health problems to begin with, but if they're not dealt with in the right way by the school and those who are around there to support them, it can add to that mental health problem, can't it, and make it worse.
Exactly, of course. Yeah.
I mean, do you have any examples of that?
Oh gosh, there's so many. Yes, I mean, I'm trying to think of all the people we tutor. We have 2 young people with autism, for instance, in another borough. They're very able. They have a diagnosis of very high functioning autism, but the nature of their needs means that they get very anxious, they get very stressed, and at times that boils over and they might throw something, they might hit someone, they might run away, or they might refuse to go to school. And because the schools were not able to put in enough support for those young people, enough one-to-one support and enough flexibility for them to learn in a place and in a way that they could manage, then that meant that their behaviour then escalated to the point when they hurt someone, and they have been out of school now for many months.
Yeah, I mean, I mentioned a case earlier to you where a child of 9 was taken away from his mother because of housing issues, and I'm not sure what those housing issues were. And although the housing department in that local authority, and it's not Enfield, but although the housing department was willing to help, social services played it by the book and took that child away. That child is now traumatized. Now, those are sort of problems you face where you have traumatized children who are taken away from their parents, excluded from a school, and people around them who don't understand the sort of dire problems that they're going through.
I would say that case, which I don't know, so I can't comment on that particular case. Basically, social services have a responsibility to remove a child if they're in danger of, at risk of significant harm within the home. So that can happen, of course, if the housing conditions are so poor that it's not safe for a child to live there. I don't think children are removed for that reason very often in my experience, but of course that can sometimes go along with parental mental health issues or parents turning to substance abuse and so on because their lives are so very difficult. Certainly, there are a lot of looked after children in the system who also have mental health issues and who may indeed be excluded from school for their behaviour. I would say a fair proportion of the children we work with providing home tuition and support have had attachment difficulties in the past. That may be a bereavement, or that may be removal from their home for a time. All sorts of things may have led to that. It can be the bereavement of a grandparent they were very close to. But attachment disorder can often lead to behaviour which is very challenging and which does not respond to zero tolerance policies. It needs a completely different approach.
So when social services is dealing with a case like the one that I mentioned above, do you think it's important to have someone who knows about special needs in the team before a decision is taken? Because I get the feeling sometimes it's taken without the right expert advice there to help make the right decision.
I think that's very possible. And of course, the Special Educational Needs and Disability Code of Practice was designed especially so that social care, health and education work together and co-produce plans and co-finance plans too. Unfortunately, again, I think because of austerity and the cuts that have happened, that's happening less and less. So when I worked in the Complex Needs Department in Barnet, up till 2010, I managed the Children with Disabilities social work team and all the advisory teams in education that supported children, and the hospital and home tuition team. So what that meant is we would have a very joined up approach with social care. And although I didn't manage people from health, we did work extremely closely also with health professionals. I think with the budget cuts now, many of those integrated teams have broken down. It's gone back into silos. So social workers work without a full understanding of education and educational need. And indeed, educational advisors work without a really good understanding of social care and how that works.
And when you add the housing department to that mix, it makes joined up working even more complex, doesn't it?
It does indeed. The early support program I used to manage, for instance, we had housing coming to all our training. We did training for key workers in all parts of the community. And one of the groups that talked to them about issues was the housing department. We felt that's absolutely key. So many of our families have housing issues. So of course, I think one thing that's got to be borne in mind, that having a disabled child itself very often leads to the breakdown of families, and families having to go into onto receiving benefits because they have to be home with their child. If their child doesn't have a school place, the family has, one of the family, and often they are a single parent, then has to give up work to be home. They get plunged into poverty and onto benefits.
And that brings a whole nother department into the equation as well. I mean, you yourself have come across problems of lack of joined up working, haven't you? Because you've been interested in setting up a therapeutic tuition centre, and you've come across the problems of talking to different departments who weren't actually talking to each other. Tell us a bit about that.
Well, gosh, there were a few, again, lots of bodies involved and not much joined up thinking going on. So we proposed that rather than working with all our children who are excluded from school, rather than working with them one-to-one in the family home, with all that implies in terms of parents having to be home, of children being isolated, of children being at risk of grooming when they play online games a lot, or when they're out on the street where they might be brought into contact with gangs, all that risk of having children at home, having home tuition for long periods. Bearing in mind, home tuition is usually for 2 or 3 hours a day. It's very rarely full-time as school would be. We proposed that we would bring them into a centre where they would have both a teacher at all times and a therapist, a fully qualified therapist, and a mentor. The ratio would be 2 children to 1 staff member, or even 1-to-1 where that was needed. And we plan to work very closely with schools to work towards transition back into school for those children and young people. We actually rented a youth centre, and it was a really good premises, of course, designed for young people, perfect for our premises. But we, on top of that, of course, brought in all the IT, the furniture, the curriculum, and everything else that we needed. And we worked with them in the centre for 15 hours a week. And then we took them out into the community as home tuition and support in the afternoons. Unfortunately, we fell foul of two things. First of all, the youth service doesn't really have anything to do with the education service, which people may find a little strange. It's true. And so one of the problems with the centre was that there was the temperature of the water in the kitchen was too hot, and there was no hot water in the basins where the children's toilets were. The youth service did agree to put in a new boiler and some new plumbing, but proposed to do that during the school term, so we would have had to close. When we said, well, that's not going to work for us, can you do it during the school holidays? They said that was nothing to do with them, and that was the date it had to be, in March. When we spoke to the education department about this, they said they had nothing to do with the youth service, so they couldn't speak to them. I think that's a bit bizarre. Once you are a school, if you're a community school, that work would always be done during the holidays. That was one issue. Then the next issue we came up with was the Ofsted and Department for Education rules on registering, and that they don't want unregistered schools working with children with education, health and care plans, or indeed anybody else. We hoped we would get away from that by only having them on the premises 3 hours a week, three hours a day. But in fact, when the council concerned got the Ofsted call, they were fearful that Ofsted would say, well, actually, these children are getting the bulk of their education in an unregistered school, and come down very hard on them, possibly failing them. And therefore, we had to close at very short notice. And those children, very sadly, had been out of school for long periods. They went back to home tuition. I've since spoken to people about this, and basically the net that's spread out to catch unregistered schools who have very poor premises, who don't provide a proper curriculum, who may be radicalising children. The net that's spread out to catch them quite rightly catches up premises like ours until, and this could take many months or years, until we get all the work done to the premises so we can register as a school.
I mean, so there are problems of the local authority not talking to each other, and there's a problem with Ofsted. On the local authorities, I mean, did you not say to them, look, why don't we have a meeting with the youth service and the education department, and let's all work it out around the table? And if you did, what happened?
Well, I have to say that unfortunately, the issue with the plumbing was superseded by having to close because of the Ofsted rules. So we didn't have that conversation, in fact.
But is that the sort of conversation that should take place? I mean, should someone like you and people outside be the catalyst to bring people together, or should we say, that's stupid, they should be talking to each other anyhow?
I think they should absolutely be talking to each other, because what we were offering, we were obviously paying a rent, and quite a high rent, for a premises which is not used at all during the day. Youth centres are closing down all over the UK because there's not enough funding to keep them open, and that in turn is forcing young people out on the streets. The young people who would have gone to youth clubs and activities in youth centres are now at a loss, and they're going out on the streets with all that can happen there. Renting those premises to people like us would, of course, really help to keep them open for use in the evenings. So, you know, double whammy for them. And for the young people concerned, we would have provided just the education they needed in the short term and the support they needed in order to go back into school. We didn't want to be a long-term school. So we didn't necessarily want to have to put showers in and that kind of stuff. We wanted to be short-term transition placement. And at the moment, under the rules, that's not possible unless you register as a school, and that can take many months.
And on the Ofsted issue, I gather you've spoken to your MP, who's Bambus Charalambos, and he was very supportive of you, wasn't he? And also said that he'd be interested in contacting Ofsted about it.
Yes, indeed. Yes, he was very, very supportive, very aware of the difficulties in his area with so many children actually receiving no education or just a couple of hours a day at home. He knows how unsatisfactory that is, and that there simply aren't the places at the moment for those children to go. So he's very keen on our idea of having local provision, which could be quickly and effectively set up, keeping children within their community so that they don't have to go to a special school in another borough, with all the costs and the time that that costs. And yes, he did say that he was going to write to Ofsted or draft a letter to Ofsted this week, which we could send off next week and hopefully arrange a meeting.
Okay, well, that's encouraging, and it'd be interesting for all of us to find out what the outcome of that is. One thing I wanted to ask you, and I should have asked you earlier, is, I mean, special schools we talk about, and you talk about a therapeutic centre, which is a sort of school with a difference. I mean, what is the difference between a special school and what you do?
Most special schools are long-term placements for children. So you have special schools for children with profound and multiple learning difficulties, special schools for children with autism, special schools for children with learning difficulties at various levels. And all those schools aim at really keeping the children with them, providing them with an education matched to their needs in the long term. What we were hoping to provide, and what we do provide in different ways, is education aimed at getting the children back into either a local mainstream school or a special school, whatever school is right for them, but getting them re-engaged with education and wanting to learn, making progress, and keen to start attending again.
So in a way, you're a special service that provides a halfway house?
Yes, that's exactly how I'd see it. And what we'd like to do is perhaps start with some of these children at home, because they're very disengaged with education. They may not want to or feel able to come out at all to a centre. Then they could come to our centre for a short time, and then the staff from the centre would help them to reintegrate into school.
Okay, so we have all these problems you talked about, and they're quite a lot. What do you think can be done to make things easier so that you can work with young people who desperately need help? What would your recommendations be to Ofsted, to local authorities generally?
I think it would be really helpful if we could have meetings with local authorities and decide what provision they would like, what would meet their needs, and how they could do it, and work in tandem with them to set up provision. At the moment, it seems more that you have to have your provision already, and then if they think that it meets children's needs, they will place children with you. So I think that's one thing. I think another point is that you need to work together. I know from experience that what works best always is joint working between the family and the child, education, social care and health. And I think that should also include other areas like the youth service. And if we work together, we can find solutions for each child which are personalised.
So it's also about getting people together to develop a joined-up strategy. And to some extent, would you say that that's one of the problems? Local authorities do things, on the hoof in a way, and there is no long-term thought-out process that you can call a strategy.
Well, they would probably be rather upset if I said that. And I think in many cases they do have a strategy, but they don't necessarily see outside provision as being part of that. And I think perhaps we need to think more widely. I mean, many authorities have excellent provision that they set up within their local authorities. It's not that there's nothing there. There is good provision there, and there are some very good small therapeutic special schools also, but they don't tend to be local. They take children from several areas, and therefore it's a long journey often to get there, and very costly for the borough to pay for that. Also, of course, for most children, starting off with an hour and a half sat in London traffic possibly doesn't get them to school in the best frame of mind for learning. I think the other issue is with Ofsted and seeing whether there could be some flexibility. Not saying that schools shouldn't be, and provisions like this shouldn't be registered, because we don't want people coming up with poor provision and poor education, but some flexibility of the rigidity of the rules, so that places that are transition placements that provide both therapy and education kind of somewhat different criteria that they have to meet. I think that would be a really helpful conversation to have with Ofsted.
But for the local authority, in a way, you're also asking for a culture change, aren't you? Where they don't pretend that they're the all-powerful local body, but they're a body that works in partnership with others, and they've got to actually develop that and work and talk in dialogue with others. And that's a huge culture change for local authorities who have traditionally wanted to be the one that was a sole provider.
Yes, and I think it has to come from the top of local authorities. I think we need to, to speak to people running the local authorities at director level, because the people below them who run the individual services, such as SEN services, they have their hands tied. If they're told they can't do something, then they just can't do it. And certainly what I found in the past, when, for instance, I set up an early support service in Barnet some years ago, was that the direct support and the direct input of our director of the children's service was incredibly helpful. That made a big change to how we all worked together at that time.
Okay, well, we've sort of come to the end of this now, so let me ask you the question I did, the last question I asked you before. If people wanted to know more about what you do or get advice from you, how do they make contact?
I'm very happy for you to share my contact details, either the office and the mobile phone and my email. And people can get in touch with me through any of those ways. Okay, well, that's really great. And this has been a very different webinar from the last one, where we've actually talked about some of the institutional problems and cultural problems that you have to face when you're developing a service in partnership with others. So I think it's been well worth going through some of those problems and talking about what the possible solutions are. So, okay, so thank you very much for doing this, Barbara, and I'm sure we'll talk to you again in the future. And we'll end this interview now. Thanks very much, Francis. Goodbye.